Now, a mother and daughter from this region have been chosen as the new faces of a charitable heart disease advertising campaign. Sue and Karen Tuffys' story is now told through TV adverts and on posters. And before we meet them, here's a look at one of the ads.
Fear was my first emotion. I lost my dad and I thought, I'm going to lose my mum. This can't happen. I just wanted to wrap her in cotton wool. She calls it mollycoddling. I trolled the internet, came across the British Heart Foundation. I found out they encourage gentle exercise. Now she's in a really good place. We speak every day without fail.
It's very upsetting to watch. We're also joined by John Brown, who's the volunteer manager, and he's not auditioning for Pop Idol. He's unfortunately got a sound issue, so he's got his own little mic there. First off, let's start with you. Why were you chosen for this campaign?
Well, it was through my mum, really. My mum had a phone call from the Heart Foundation to ask if we'd like to be involved in the campaign through some previous work that my mum had done with the Heart Foundation, hadn't you?
Yeah.
And, I mean, it must be quite daunting to be asked to be in an advert. Obviously, it's not what you do. So did you have any reservations, or are you just passionate that it needs to be told?
There was such a big help for me and my family when my mum went through what she did. So it was really, we felt honoured, to be honest, to be asked, and it was nice to give something back.
Absolutely. Sue, did you feel that you needed to do this, and what message did you want to get across?
I felt as though I had to do this, and I wanted to do this, because if this advert just saves one life, I think it will be brilliant. And even off the phone calls, if they get hundreds of phone calls off this, which we know they have, we've done our job.
So just very briefly, in a couple of lines, just tell me how it happened for you and the problems you had.
When you've had a heart attack, it's so frightening getting back on your feet again. Not just the actual heart attack, it's getting back on your feet, knowing what to do. And they were there. They were like my best friend, my nurse. British Heart Foundation nurse was just like my best friend. And
how did it work when you were in hospital? That you suggested that you spoke to this organisation, or did you have to do the legwork and find out for yourself?
No, they came to see me. It was an automatic thing that they came to see me before I was discharged from the hospital, and explained the programmes that I would go through, the rehabilitation courses and things. Always on the end of a phone if I needed her. And like I said, she was called Sue, just like me. But she was always there for me. Anything little that you needed to ask, she was always there.
OK, let me bring John at this point, because you're the volunteer manager, aren't you? So why is it so important for this new campaign, which is called Heart Matters, isn't it?
Yeah, Heart Matters is really people taking care of their heart health. One of the striking things about Sue and Karen's story is that it shows very clearly and very graphically and very tellingly how a heart attack affects not only the person who's suffering from the heart attack, but also the close family as well. The impact is quite traumatic. And I think one of the things that Heart Matters is really focused on is people taking a little bit more responsibility of looking after their lifestyle to try to improve their heart health, not only for their own benefit, but for the benefit of all those close to them who care about them.
So if we came to you, even if you've not suffered with heart issues, if somebody came and they just wanted a healthier lifestyle, what advice would you give them?
Well, it's about diet, it's about exercise, it's about being conscious. It's about making little changes to the lifestyle that might actually make a big difference in terms of your heart health. Small things can make a massive difference. One of the things we've got at the moment, we've got National Heart Month next month, which is going to be focusing on how to look after your heart better, try to raise some money for us to help us support people like Sue and Karen all the more. We've got a Healthy Lives Roadshow on at the moment in Greater Manchester. It's at Trafford Centre this week. Next week it's in Salford. Week after that it's in Tameside and Stalybridge and Ashton, giving everybody an opportunity to just take a few minutes out of their life to come and check on how they're doing things, how they go about living, what little changes can they make that make a massive difference. And I think it could really have a massive effect.
OK, many thanks. Actually, time's beaten us, so we can't talk about it anymore. But I'm glad that you're happy and you're healthy now.
Thank you.
Thanks very much for joining us.
Thank you.
Cheers. Thanks.